I'm doing it twice. I'm gonna pick my best service and submit that.
I take my glasses off.
Oh, look, you can see right there. Can you? Oh, I can see you. Sorry. Yeah, take one of those. You got one of those?
What do you want to get it? Oh my God! Why don't you sit on my lap,
You want me to?
woman?
I'm not a woman. Talk to me like that.
Oh.
One of that one.
All right. So my original plan was to show you my awesome acting skills, which I have none. But
Right.
so I'm just gonna what?
You'll do it.
No, well, no, I'm just. I was gonna pretend to be a resident, but I don't know if I can pull that off. So I'm just gonna tell you. So you have a resident, right? We have lots of Alzheimer's residents here lately. So they're wandering around, insisting they have to go home, they have to get out, their family's waiting for them. What would you do in that situation?
When they're doing that,
Right.
redirect them with another activity.
Oh, you have the perfect answer. Why am I even doing this for you?
I was thinking this is sticky.
Absolutely.
Yeah. Redirect.
Redirect. You haven't heard it yet, you know? Okay.
Hand massages and foot massages. I just took CNA classes right now, so
Oh,
I'm like
you're
a
taking-
pro. We just went over this whole modifying behavior thing.
Oh, did you?
Yes, that's what we just did.
This has been drilled into my head for a very long time. Okay, so I brought all sorts of fun props. Not that props are always necessary. A lot of times just, you know, I have to go, you know, my husband, oh, what's your husband's name? You know, where do you live? What does your house look like? Just, you know, get them off the subject, you
off
know.
the where's the door.
Yeah, hopefully they'll kind of forget about where they were headed. But, so I brought a bunch of props, and the first time I just laid them out on the table, and I was going to have you guys separate them. Maybe I will do that. Alright. It didn't go so well, but I had more people. So I'm going to put all these things out, and let's say you put, here, put this over by you guys.
Yeah, close to
Put-
the hand.
What you think would be good for someone with Alzheimer's on this side, what you think would be bad on this side. So it's totally up to you.
I think this would be good.
That's good.
This is good.
Yeah, bad.
This is it's probably too small.
Sorting chips.
Well, that's just a find it thing, huh?
Mm-hmm.
What do they do?
You just
Find-
find what's in there.
Oh.
Yeah.
Be good.
And that would be good.
Sorting chips.
Like folding clothes for Verona. And,
Okay, so this is good. Cards. Playing cards.
that might be it.
That's hard to remember. You know what I mean? You gotta remember what you're doing when you're playing cards.
Mm-hmm.
Probably not.
Photo
Pictures.
album.
Yep.
Yeah,
Those are good to look at.
A cute little puppy.
That's
Yes. That's wonderful.
It's got
Looks
a broken...
just like the little ones that are down there, you know.
Okay. One of those little magic mind games.
Nope.
Holding clothes.
Yes.
I think you guys did an excellent job. The only thing I would say, I don't know that I would give someone with dementia or Alzheimer's this. I would be really... I think they'd probably forget what they're looking for before they found it. You
Well, I
know?
was thinking of Verona. That kind, you know. That's
Right,
not
right.
that
She's
far.
not...
Depends on what you
Yeah.
have.
And
How
how
Yeah.
far?
A lot of it
dementia
is,
or-
absolutely.
Because Verona would like to look at it, you know. She would like that.
And whether they remember what they're looking for or not, they're going to find something.
This is true. This
Right.
is true. Absolutely.
And then the colors and, you
The
know.
colors, right. And it depends on
Yeah, how far.
how agitated they are.
Yeah, right.
And
Let's-
absolutely, there's a lot of factors that come into play with this. It makes it kind of. You really have to be on your toes.
Yeah.
Okay, so now, if I just remember where I'm
I'm
going.
just dying. I can't wait to get
What
home.
is your problem, Dad? Oh, were you holding those puppies?
I can't get that. Sorry, we're on camera.
You're fine. Okay. So, yeah.
So yeah,
What do you
that-
think? I'm just gonna give you a few examples. Like, let's say Mary Ann's wandering into resident rooms and just looking for something. What, if you had to pick one of these things to try and say, here, let's look at this instead, what would you probably pick?
Folding clothes, maybe.
Either folding clothes or the photo album.
Yeah.
I think that would be very good choices. I'm just trying to think. What about the really, really agitated resident? You've tried all of these things, and none of it's working.
What do you do next?
Walk out. Let somebody else try it.
No, that's true though. That's true. Send somebody else in. Give them a different face to look at.
Right.
So, maybe somebody will word it just that much
Different.
different. That.
You'll make it better.
And, maybe somebody else, whatever they do, that doesn't work. So that, I would say if worst comes to work, you just let them walk around and just keep
let
on
them
walking
wander.
and make sure they're not going to hurt themselves.
themselves.
Right, or
Yeah.
get out, or
Yeah.
absolutely.
Yeah.
Okay, let's say you and Marianne are looking at this photo album,
Okay.
and she's all here, she's just starting to get distracted, and I gotta go find this and that and this, and is there another way you could get her back involved in this again, or
Bring her to a different room and look at it again.
bring her to a different room?
Sometimes.
Yeah, absolutely. Got a good answer for me, Deb?
I'm thinking.
No? What if you go through and you find, oh look, she knows that person. Well look, here's
Oh, yeah.
so and so, and oh well, look, let's turn the page. Look at those people, and just
look at a different
Abs-
picture and
absolutely.
then start talking about
Yep.
yeah.
just kind of
Do you know that
try
person
a
and
different
just
angle.
Yeah.
And although I have definitely taken that too far too, and then you just agitate them more. But it's
Right.
worth a shot.
Yeah.
And if
And
you
it
can
has
kind of
to-
tell they're starting to get a little worked up, just back off.
Yeah.
Yeah. I'm trying to. We had so much talking, I don't remember what I'm even talking about now in this earlier one I did. Okay. My little pamphlet I gave you. It's not super relatable to, it's based at people caretaking at home, but I thought there were some really good points in here. Page 4, under the activity section. You guys have like 4 and 5 together, and I think I really liked their points here. Encourage involvement in daily life. If like Verona used to always fold the clothes, that's what she would do at home. They need to feel like somebody needs them.
Mm-hmm.
They want to feel helpful. Have them dust. Have them take out the garbage. Have them, I don't know. For some reason, polish their lamp is coming to mind, because Vivian always tells me she takes those hand wipes back to her room to polish her lamp.
Oh, yeah.
And kind of like what we did with Earl too. You have to know it's a lot about knowing the resident. Like with Earl, we took woodworking stuff in there, pieces of wood, sandpaper, which didn't really work, but it's worth a shot, if you can relate it to something they did earlier in their lives. And if one thing doesn't work, just try another. Just keep changing it until you find something that do. Keep changing faces.
Yeah.
I feel like I'm not telling you anything you don't know.
He likes that newspaper.
Earl does? He really liked, last week we went out and sat on that swing in the courtyard. I felt so bad I had to tell him he had to go in. I had to leave. I couldn't go over my hours.
Oh, I bet.
So-
Wait till it's nice out, because I usually go take them for a walk.
Mm-hmm.
No, I'll go in the front door, like Verona, and take her in her wheelchair, and then we'll whip around and come through the hospital doors and come back, and then I'll go get another one.
Oh,
whip
there you
her.
go.
Just, when you have a few minutes, just take one out, because they love it.
They do, right.
And
Well,
just when the summer is there and the flowers are on, and,
Well, except Earl, you can't take him out the front door.
no, but you can take him in the courtyard. I
Which-
have not hardly seen him so calm and relaxed as
As
he
he
was
was.
on that swing.
But
He just kept saying, this is so refreshing. This is so
just
nice.
the air.
Right? Fresh air.
Even if he's in a wheelchair.
Mm-hmm.
Fresh air.
Just- Well, and I should actually teach you guys how to use that swing out there, because you can put a wheelchair on that swing. We had Verona on one side and Earl and I sat on the other.
Really?
Mm-hmm.
I
Because
think
I
I
thought
know,
that's
but
what it's for.
I thought it was broke at one time.
No, it's
They
not
must have-
broken. We were on it.
Huh.
So,
Here, I thought it was broke.
no. It's pretty simple to figure out.
Oh, yeah, they'd love that.
Mm-hmm.
Sit outside.
That's absolutely out in the courtyard where they can't go anywhere but back in.
Yeah.
Okay, let's see. Another thing I have is one that really gets to me is concentrate on the process, not the result. It doesn't matter if they're folding towels the wrong way or they're putting stuff in the wrong order. It's keeping them happy, right?
Keeping them busy.
Yeah, busy, happy is what, if you gotta go over it when they're done, so be it.
Yeah, whatever.
Be flexible, very, very, very flexible around here. Another good point, it has to be simple, short steps to follow. You can't say, here, I want you to cut, color, glue this.
And
Like they're gonna remember.
Right, they're going to say, okay, well, what do you want me to do?
Right,
Which one do I do
start where?
first? Yeah, absolutely. We went over this, make sure they know they're needed. Definitely do not criticize or try to correct them if they're doing something wrong unless it's going to harm themselves or someone else. If they're doing something wrong and it's not going to hurt anybody,
Let them do it.
let them be. Absolutely.
And that's what I think.
And if you're sitting, you're sitting with them doing something, and not that you guys have a whole lot of time to sit around with residents, but if you, if you are, talk to them while you're doing it. I know you do a really good job of that, Deb.
I do all the time.
You
Pick
are
on
always talking to
everybody.
them. Yeah, make sure you're talking to them. Talk to them, not at them. I feel like a lot of the residents feel like they're talked about, like they're not even there sometimes. So,
Yeah, I understand.
that can be frustrating. I know I even went through that when I was in the hospital and had my son. You can hear the nurses out in the hall talking about you and...
Really?
Yes, absolutely.
That's sad. Tell them I can hear you.
They
I would too.
absolutely. Residents can hear a lot more than you think, even if they are hard of hearing.
Actually, I would have though.
Would you? Oh, I
don't.
didn't say anything.
Oh,
I just
yeah,
thought,
but
whatever.
you know my mouth. I
Yeah.
hear you out there.
We already went over try again
Not yet.
later. Oh, this I thought was kind of cool, just a little thing to have with it. 10 quick tips. Be flexible, patient, encourage involvement in daily life, avoid correcting. I don't know, I just kind of started because I thought it was a cute little... help them remain as independent as possible, which is a really cool thing about the activity department because we are the only people that focus on what the residents can do, not what they cannot do.
Right.
Absolutely. So, give them a couple choices. I would say probably no more than 3, depending on how far into dementia Alzheimer's they are, no more than 2. And sometimes you just have to say, let's go do this.
Right.
It's not a question, it's a command.
Right.
Let's see. Familiar routine, which is hard to do with different staff sometimes. Simplify as much as possible. And always provide encouragement and support. And I do have to go over, too, one very important thing that we do all the time, which I sometimes feel bad about. I'm just apparently way too honest of a person. The little lies we tell them. Always, therapeutic lying reduces stress. It's true, and it's not always really a lie. It's true.
like
But
Earl's car's been broke.
in the
you know,
shop.
In the
or-
shop or flat tire.
And then I always say Bonnie. What's her husband's name?
Norman.
Norman. He's down waiting for us for breakfast.
Well, I guess
Oh,
I don't
do
tell her
you?
that.
Sometimes.
Well, I don't tell her that. I tell her Norman
But she'll
called and
forget.
said, right, but I always tell her that
You know.
Norman called and
Right,
wants you to
it's
come
probably
down.
see, and that I could right. There's some truth to that because he does want her to go down.
Mhm.
You maybe didn't call, but you know that was what he
Yeah.
wants
Right.
her. I just did that with her last week. She wanted to go home. I said, "Oh no, Norman called. He's way too busy. He wants you to stay here." You know.
Yeah, you do.
You have
Yeah.
to. It's
You
sometimes
yeah,
it's just-
you have to for everyone's sanity. They're gonna get mad. You're gonna get mad.
But that
It's not
was when
gonna
she
be a
was
good situation.
confused, that really, now she's getting a lot better.
Mhm.
Yeah, she smiles.
Yeah.
She's
Absolutely.
Yeah,
Usually
look,
rough.
I laid on her bed and she goes, "Are you comfortable?" I said, "Yeah, I am." She starts laughing.
Oh, here's a little. I have one more little quick fact for you that is actually really cool. Alzheimer's and dementia patients actually retain more abilities than they lose. They maybe just don't get a chance to use them. So that's cool. If you know a little bit about them and what they did, maybe we can try and figure. And you know what? Absolutely, if you guys have an idea, oh, you know, so and so might like this, please come and tell us so we know too. And if we know something good, we'll try and pass it along to you. And I absolutely want to make more of these activity things more available to you guys in the evenings, weekends, you know.
That we can, yeah.
And what I really want to do is do a bunch of sensory boxes, which are really cool. We don't have any here at the moment, but maybe we do. I don't know. I had to make one last semester. I did one on baking. I put like a whisk and some spices so they can smell, you know, things to touch. Maybe an old recipe card.
Oh, that'd be cool.
So that's my goal, is to put a whole bunch of those together and put them like out in a solarium. So that when you need, oh, so and so's freaking out, let's see if we can do this with them.
That would be cool,
That would be
Ashley.
cool.
Yeah, that's my goal. That's my yes. So.
Yeah, that would be nice.
Mhm.
Give them something besides, yeah.
Right.
It's got like,
Yeah, I feel like we park them in front of the TV or something. Too much.
Well, ideally, like, have you even seen nursing homes where there's just dressers and stuff around, and there's this corner full of this stuff, and just for the people who are wandering, they're looking for something, they're not quite sure what it is, but it's safe things
Something
for
to
them to
find.
go through.
Yeah.
Right. So, I don't know. I have a lot of dreams, but I'm not sure they're all gonna happen.
I'm not sure about the
we
budget.
went to, me and Chastity went to the, God, what, Adrian, was it Adrian's garage sales or whatever, you know, we went by the nursing
Oh, are you
home.
thinking Edgerton?
Edgerton.
They've
And there
got a
was-
nice nursing home.
There was like 5 women out just walking in their walkers. I told Chastity, hurry up, they're getting away, get their goddamn alarms on.
No, that's
Chastity just says, "Oh my God, Mom!" I says, "Well, it's true. You can't go outside here. You can't walk around. You know what it's like. Come on, Mom. You know you feel so."
well, you know, I feel like a lot of it is the building itself.
Yeah, because it's roads right there. You know, this place had a nice.
They've
but
got,
they
you
had
know,
a
this little
driveway.
area with a gated off section.
But these guys were out front walking around with their walker. It was so cool.
To see.
Yeah.
Yeah, wild. Is that everything?
I think, yeah, as long as you. Did I teach
We
you
know.
anything?
Absolutely.
Yeah.
Alright, you got any
You did.
questions?
Now you better record. I mean, take that off.
I will shut that off.
Yep,
Thank
sorry,
you.
I'll take-